wanted to take the time tonight because this is what we do here that others don't. I'm not making you a pitch, okay? I'm not selling you an agenda. I'm helping us be on the same page about what the issue is and being open to what we need to make happen. Now, somebody who can be part of figuring out a solution structure joins us now. Administrator of Medicare and Medicaid Services, the doctor who always seems to be in the right place at the right time, Dr. Mehmet Oz. First things first, what happened on that stage, and is the guy all right?
Gentleman's okay, and when you're standing that long in the Oval Office, folks sometimes get lightheaded. He collapsed. We put an IV in. He got excellent medical care, and he's on his way home to his wife already. So one little lesson, by the way, you don't have to be a doctor to know this. If someone's about to collapse, catch them, because the injury is not from what caused them to collapse. It's because they banged their head or hurt themselves. So just get under the person, doesn't look like they're going to make it, wobbly knee, and grab them and bring them to the ground carefully, lift their legs up, and wait for help. But since we're talking about helping crises and issues that are problematic, you touched on the healthcare expenses that are dramatically increasing in this country. The reason that we had to actually increase spending in Medicaid under the One Big Beautiful Bill, there's no cut, by the way. It's increased $200 billion of spending in this program for the next 10 years. The reason the president did not want to touch Medicare at all, and he will not touch Medicare, is because these programs are growing at the 7% rate, roughly, that you're describing. And that's a lot faster than the GDP. So the affordability issue you mentioned becomes problematic. My job is to make sure the $1.75 trillion that we spend on Medicare, Medicaid, the Affordable Care Act, is spent wisely. And the only way to do this without just throwing money at a growing problem is to get to the root cause of what's increasing costs. And Chris, take a step back. The number one thing we can change pretty readily that drives more than a quarter of the total healthcare expenses is obesity and obesity-related conditions. So I know this is going to blow your mind, but by taking the price down, you take billions of dollars out of the healthcare system, money that's been spent by beneficiaries in Medicare. Medicaid patients don't even get the drug usually. There's a moral hazard there because vulnerable populations who die disproportionately from obesity because their food's terrible and they don't have the luxury of a personal trainer. They suffer unnecessarily because they don't get access to the drug. The number one zip code for this drug right now is the Upper East Side of Manhattan, 10021. And so we have to make these drugs affordable for moral reasons. But if we're able to do this correctly, and this is important, we will actually, within 2 years from when that ink dried in the Oval Office today, within 2 years, we will actually save the American taxpayer money for the first time maybe on health care because we'll be driving down health care costs by giving folks access to a medication that with downstream benefits, not just from the obesity. That's not the problem. It's not looking better for swimsuit season. It's less diabetes, less hypertension, less heart attacks, less renal failure, less dementia. All those problems begin to diminish at markedly higher levels than we would ever have expected. So this is one of those foundational elements that we have to address. Most favored nation pricing is simple. It is wrong for Americans to spend 3 times more for the exact same drug made in the same factory with the same bottle and the same packaging in this country versus Europe. No more global freeloading. We're going to pay the same price as other developed countries and save American lives while we're at it.
All right. Look, you always get to make your case here, Doc, because I like you, but also that's how we do it. Let's put to the side that we do not know that people without the specified conditions of what these drugs were developed for are going to be fine taking the way so many are taking it right now. We don't know yet. They're still studying it. You know that. We've talked about it. Yeah. So let's put that to the side. This is not the root cause of obesity in this country, nor is it a magic pill to get rid of the obesity. It's the quality of the food. It's the amount of money that they have to take care of themselves. This is a rich people problem who are taking this Ozempic and Wegovy. I'm with you on obesity. I just don't think this is what gets us past what the endemic and systemic problems are that drive it. And if you want to address affordability, I do not think starting with Ozempic is going to make the American majority feel like you get their problem.
Chris, it's a belt and suspenders approach. Obesity is not a deficiency of GLP drugs. There's no question. It's driven by the food that is remarkably deficient in nutrients but rich in calories.
I know.
That folks who are vulnerable have to consume. That's the food they get when they have SNAP benefits. That's often been the food that we give them on Medicare Advantage plans. We're changing that. That's what those SNAP waivers are about.
Good.
It's about physical activity. You have to have the energy to work out. When you're working all the time, it's hard to do. And at its very core, things as simple as sleep are remarkably impactful in the weight you put on. But obesity is a national scourge, but it's especially a problem for underserved populations. And they never had access to a plan B. Because if you can figure it out and lose weight and look like a gazelle the way you do, fantastic. But most people struggle, especially as they age. And if we don't help them with whatever options are out there, especially with novel technologies and innovation, creating pill versions. I learned today, by the way, share it with your audience, when I cornered one of the pharma executives in the Oval Office, but they believe by March they will have a pill that you can take instead of the injection. Suddenly, these become a crutch that's possibly used by a lot of Americans. We think 1 in 3 Americans could use these, again, to get back to their playing weight, their fighting weight, to get fit and strong, and they can flourish in life. And then hopefully when they get there and pick up some lifestyle skills on the way, they can maintain their weight at a healthier location. But right now, we are twice as expensive as any other country in our healthcare because we are twice as fat as every other country. We're 10 times more obese than the Japanese. 10 times.
I'm with you. I'm with you, Doc. One of the reasons I could never do your job, forget about the education and the pedigree, is I also don't have the benevolence. Okay, I think people are fat because you got a lot of people who are undisciplined and lazy. Now, you also have a lot of people who are fat who are poor because they're completely stressed out. They're working 2 jobs. They can't afford good food. They're places of food deserts. And they're worried about putting a roof over their heads and what they're going to do with their kids. And the anxiety levels are crazy, which is why we're getting more and more open to crazy ideas. But you are here to make the case. You are welcome to, and I'll talk to you about this again, Doc. Thank you for doing it. If I don't speak to you before,
one last
have a happy
plea.
Thanksgiving. Go ahead.
Same to you, my friend. But President Trump was brave. He took on the entire pharma industry. This was the 4th of these most favored nation deals. We had the leading company in America, leading company in Europe, all the fertility drugs, now obesity. He's marching through all these companies. And as a president, to be able to take out tens of billions of dollars out of the healthcare budget by just renegotiating better rates, that's pretty impressive. You got to give the president kudos for making a difference, at least in this area.
100%. You make things that are needed by American people more affordable, especially when people are just gouging us. That is a good thing. I don't care if you're right, left, or reasonable. I just don't want it to be the fat pill, as he calls it, or the fat drug. I just think they should be the drugs that matter most to the most people. But it is good if America gets better deals, and I appreciate you pointing it out, and I'm happy to hear it. Dr. Oz, I'll talk to you soon.
Bless you.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.